Laura. So in most states, the open enrollment period, the annual period where anyone can enroll in Affordable Care Act insurance has now ended, but in certain states, you still have time to enroll. In New York, the deadline is tomorrow to enroll in coverage for this year. So if you are in New York, get shopping ASAP. If you are in Colorado or in Maryland, you have until at least the end of the month. So you have a little more time. We would always recommend going to your state exchange website, seeing what you qualify for as soon as possible to make sure your coverage kicks in ASAP.
Great. And what should people do right now if they're in a state that doesn't have open enrollment? Are there reasons that they could still be eligible for an insurance plan through the ACA?
Yes, there are. If you have what's called a qualifying life event, you can qualify to enroll at any point in the year, generally within about 60 days of that life event. The most common one is losing coverage through, for example, a job or through Medicaid. But if you have gotten married, had a baby, recently been released from incarceration, become a citizen, there are many, many reasons that you might still be eligible to enroll. If you're not sure if one of those situations applies to you, or you think you qualify for a different reason, you can call us at Health Sherpa, you can call healthcare.gov or your state exchange, work with a trusted local broker or a sister and see if you still might be eligible to enroll.
And what about if you're low income? So are there specific times to enroll in Medicaid if you're eligible?
Great question. So Medicaid eligibility, Medicaid enrollment is actually year round. So if you qualify in your state, and really important to note that states' eligibility requirements for Medicaid can vary. In most states, if you make below about $1,500 a month, you may qualify as a single person, and more for families, you may qualify for Medicaid. And again, that's lower no cost coverage offered through a state federal partnership. It's going to have really low copays and can be a really great option for many people. So if you are lower income, always worth going to your state Medicaid office, checking to see if that might be something you qualify for. If you apply through Health Sherpa or healthcare.gov, we will also automatically screen you to see if you might be eligible for Medicaid as well.
Okay, and what if you're not eligible for any of these things and the time to enroll is past? Can you talk a little bit about short-term plans and how they work?
Great question. So if you are in a situation where you don't currently qualify to enroll on the Affordable Care Act marketplace, you might come across other types of insurance products like short-term health insurance, health sharing ministries. There's a wide variety of products that are on offer. What we say for these is it's really important to read the fine print. These kinds of products are not held to the same standards as Affordable Care Act plans. They don't necessarily have to cover pre-existing conditions, may not offer coverage for things like preventive care or maternity care or mental health or a wide variety of things. So, if you're in in a situation where you have no other options, that's definitely something you can look into, but really be careful and buyer beware.
Okay, and the next period for open enrollment is in November?
That's right. In most states, open enrollment has gone historically from November 1st to December 15th. The healthcare.gov actually extended that this year, so it went through January 15th. But it's important to know that states that run their own marketplaces that don't use healthcare.gov do have slightly different dates. So it's always worth double checking what the enrollment period is going to be in your specific state. I will also mention, if none of those other qualifying life events apply to you, like losing a job, having a baby, moving, there is a new special enrollment period that is currently being finalized by the Centers for Medicare and Medicaid Services. It has not gone live yet, but I'm sure we will talk about it on the show, so stay tuned. And that is going to be a special enrollment period based on your income. So if you make less than about $20,000 a year as a single person or $40,000 a year as a family, and none of those other life events apply to you, stay tuned. You might soon have an opportunity to enroll anytime in the year.
Thanks. And so we will keep you up to date on that as it is enacted. So, next, I'd like to introduce our special guest today, Wendell Potter, who's going to share a little bit about his personal story and how he got involved in healthcare reform. And he has some inside information from the other side of the story from his time as an insurance executive. Wendell, welcome to Care Talk.
A former health insurance company executive. As you noted, I used to work on what many people call the dark side, and I would agree with them. I was head of corporate communications for Humana and then Cigna altogether about 20 years. And I left after what I have often referred to as a crisis of conscience. I couldn't keep doing what I was doing. And I've since then have continued to be a very vocal critic of my old industry and spent a lot of time, actually a little over 10 years ago in Washington, working with members of Congress and the Obama administration at that time as Congress was working on what became the Affordable Care Act.
So, you've been watching, I assume, the process in Congress right now in trying to pass reform, Build Back Better is what it's been called, that would make Affordable Care Act insurance plans more affordable, lower the cost of prescription drugs, and so on. And so far, it's stalled out in the Senate. Can you talk a little bit about all the players in healthcare and why they might be spending millions of dollars to stop legislation like this?
Yes, and it's just absolutely a wonder that the Affordable Care Act got passed. As you may remember, it passed by the slimmest of votes, just by one vote in the Senate, and could easily have failed. But the reality is that the big entrenched special interests are just even more powerful now than they were back then. And you've got in this piece of legislation aspects of it that the pharmaceutical industry hates, that the insurance industry hates. So when you've got those two big industries fighting to keep this from happening, the chances of it moving forward are pretty slim, regrettably. And all it takes is these big corporations to get one or two members of Congress, either in the Senate, as we're seeing, or in the House side, to carry their water for them or to be a stumbling block. And that's exactly what we're seeing. We're seeing two members of the Democratic Party in the Senate just being the barrier to this passage that the insurance industry and the pharmaceutical industry, frankly, wants them to be.
Hmm. And what are the kinds of things that you, when you used to work at the big insurance agency, would say to stop reform? And can you talk about, what the truth is behind the things that you used to say?
Well, money talks, to be quite blunt. These big corporations, and like the ones that I work for, spend enormous sums of money throughout the year to win favor. They spend money in many different ways. They contribute heavily to campaigns. When I was at Cigna, my staff doled out campaign contributions to both federal and state candidates. Sometimes we give more to Democrats than Republicans. Other years it'd be just the opposite. And it would change based on who was in power and who we needed to curry favor with. And they also spend huge sums of money on lobbying. During the debate on what became the Affordable Care Act, the pharmaceutical industry spent more than any industry had ever spent on a single piece of legislation up until that time. Well, that record has been shattered, and you're seeing both pharmaceutical companies and insurance companies spend heavily to keep this from happening. And there are others. Even the American Dental Association has lobbied to keep certain parts of this bill from passing. You might not believe it, but the American Dental Association was dead set against the Medicare program being broadened or being improved to include a dental benefit. And the bill that did pass the House did not include including dental for Medicare beneficiaries, which is just an outrage. But insurance companies didn't want that either. So you had those two big influential forces on Capitol Hill keeping that from happening. It's I would say the chances of this actually being enacted decrease every day. There may be something that can pass, but drug companies wanted to, they don't like the idea of the bill being passed as it is that would allow Medicare to negotiate with pharmaceutical companies directly on a number of bills, a number of pharmaceuticals for medications. And the insurance companies like things as they are. They too don't want the pharmaceutical benefit to change all that much because they make money hand over fist on the Medicare Part D program.
Now, I mean, this sounds bleak, but did you follow at all the battle to end surprise medical billing in the federal legislation that passed a year or so ago? Like, how did they win that battle? Because I know millions upon millions of dollars were spent by the private equity firms, the hedge funds that were fighting reform because that's how they made their profits.
Yeah. Yeah, it was a battle of big industries, and one of them ultimately had to win, and the insurance companies ultimately, I think, probably are the winners here. Let me take that back. The American public we are the winners here from that legislation passing because it does protect us from being hit with bills even with insurance, for one reason or another. And typically it's because of the way insurance companies configure their networks and saddle us with out-of-pocket costs. It's complicated, but you had on the one hand, you had insurance companies lobbying for the bill to be written in a certain way. You had private equity firms and provider organizations arguing a different way. I think what was passed was a compromise. As the Biden administration has written the regulations, the healthcare providers, doctors, and doctor organizations have said that it went beyond or was other than the intent of Congress, and it kind of tipped the balance in the favor of insurance companies. I think there is some validity to that, but it was a long fought slog with millions and millions and millions of dollars being spent by both big insurance companies and private equity firms. And this, at the end of the day, is our money that we spend on healthcare or health insurance premiums. A percentage of it is just skimmed off to pay for lobbying, and that goes into campaign contributions.
Mm-hmm. Now, does this give you hope at all in that we did eventually win on surprise medical billing federally? So, what do you think are the lessons learned from the Affordable Care Act and from surprise medical billing and from the things that have failed? Like, how do we win on making our healthcare system better on a federal level?
I think, well, certainly organizing for citizens, for people to be engaged in advocacy efforts, that's very, very important. I think it shows you that it is almost essential for there to be some level of compromise among the big players to get something passed. I was, as I think you know, an advocate for the Affordable Care Act. And was so grateful that it was passed, even though I said at the time that it was not as good as it should have been, and there have been some unintended consequences even, and it also has frankly enabled insurance companies to make enormous profits in the decades since it was passed. You have to know that when you're dealing with the U.S. healthcare system, there are going to be winners and losers, certainly in the public policy arena. And it's just really important to understand that it is extraordinarily hard, almost impossible, to pass a piece of legislation that doesn't go through the mill. of some parts of the legislation being changed along the way, because these special interests are so influential, so able to influence public policy. And we saw that with the ACA. Big chunks of it were written by the lobbyists for the special interests, to my dismay, but that's just the way the world is. I will say that I think that ultimately the answer here, the way that we can make more progress, is to address the role that money plays in our political system. That is the ultimate thing that we all need to be aware of. And it's one of the things I'm going to be focusing more and more on as I go forward with my work. I wrote a book a few years ago with Nick Penniman, who leads an organization called Issue One. And it was called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. Because of big money, you occasionally get victories like the ACA and the surprise billing legislation. They come all too infrequently. And we see that certainly at the state level too, with efforts to try to enact progressive legislation, or legislation that almost everyone would agree would be in the best interest of the residents of the state. And you have special interests that spend money in enormous sums to block legislation. I saw it in Colorado. I saw it in Nevada. I saw it in Connecticut last year. I worked with advocates in all those states. All three of them were trying to enact legislation to create a state-based public option. But my old industry, the insurance industry, and the hospital industry, weighed in all of those states, doing their dead level best to keep the legislation from passing. They succeeded entirely in Connecticut. Nothing was passed, but at least in Colorado and Nevada, some version of the legislation was passed. So that gives me some hope that you can make some progress. The role that I played in that, by the way, and one of the things I think is key, is to expose the other side's tactics and to expose the lies that they tell, and to make people aware of all the money that they're spending, why they're spending it, what their agenda is. And that can be helpful if it breaks through, for people to understand. You'll see all these ads on TV saying that a public option is the worst thing that could possibly happen to the folks in Colorado. But then if you take a look at, well, who's behind those ads, you'll find that it's my former colleagues in many cases.
Mm-hmm. Yeah, and I think it's interesting to see Oregon also is working on a path to a public option that there may be legislation next year. So it's interesting and hopeful to me to see that states are figuring things out on a statewide level, the things that maybe we can't pass right now, given who is in Congress on the federal level. I think you're absolutely right about we have to fix the problem of money out talking people, because wildly popular things like lowering the cost of prescription drugs, we pay more than any other industrialized nation for our drugs, many of which are invented right here. And those are policy choices that big pharma backs, but it's hurting Americans. Yeah. So I think you're absolutely right there.
It is. And I think you also need to understand, and I think what we're seeing is that it's important to take your victories when you can. And a lot of folks in the advocacy world think the word incremental is a bad word. And that if you can't get the whole enchilada, then you have failed. I'm not one of those folks. I think that having been in the industry, having served in the role that I served in, I know how much money is spent, and I know the tactics. I know that lying works. I used to be a propagandist, so I know how that works. One of the things that I'm leading right now is a coalition of organizations to educate the public on the ever-increasing problem of underinsurance, of people who have insurance, but in many cases are functionally uninsured because they have to pay so much out of their own pockets before their coverage will kick in. And this is true of people who get their coverage, regrettably, through the ACA marketplace plans, as well as employer-based plans. So The coalition that I lead, called Lower Out-of-Pockets Now, is focused on educating the public, policymakers, and employers about how devastating these can be to so many families. It sends so many people into bankruptcy, so many families into bankruptcy, and others, when they get the care that they have to have, into medical debt they often will probably never pay off. And it also keeps a lot of people from getting the care that they need in the first place. They will delay going for a diagnosis that could have saved their life if they had gotten, or going to a doctor when they had symptoms, but they just were afraid that it would cost them too much. It's having a huge effect in that regard as well too. So that's an example of tackling one part of our healthcare system that needs to be addressed. And I do think, and in fact I know, there is bipartisan support for that as well too. I do know also that my old industry will be trying to stand in the way to keep progress from happening. But I think it's really important to be in the arena on that regard as well. In that regard as well.
So, what would you say to somebody right now that is not able to, maybe they have health insurance, but they're not able to effectively use it because of the costs are so high? Should they be talking to their congressperson or their state legislator? Like, what should you do if you are mad at the system right now and you want it to change?
Absolutely reach out to your state legislator and your member of Congress, your senator. Let them know that you're in a high deductible plan, if you are, and most people are now, and that you're concerned of what that might mean. The problem is, of course, that fortunately most of us in this country go year in and year out with good health. You are certainly an example of someone who probably had good health and then you didn't, and then you realized what happens when you get a dreaded diagnosis and have to be treated for a very dangerous disease or condition. So that works against us, but I would encourage everyone to reach out to your member of Congress or your state legislator as one thing you should do. The other is, please don't not get the care that you need because of concern about an out-of-pocket obligation. As terrible as that is, there could be some things that you can do after you get the care that you need to try to reduce what you owe. There's a good book out that Marshall Allen, who's a former reporter at ProPublica, wrote. It's Never Pay the First Bill. And it's really solid advice. And he gives example after example of people who have been hit with bills that they shouldn't have been hit with, errors that were made on the provider's part or on the insurer's part. So don't pay the first bill. Figure out ways that you can negotiate for a lower out-of-pocket payment, or just try to see whatever you can do to reduce your obligation. And sometimes you can get out of paying the entire bill.
Yeah, and we have future shows where we'll have experts that give you advice on how to fight a medical bill, how to fight a denial of care if your insurance company refuses to cover something that you need. So, given your experience with the insurance industry, what are the things, if people live in a state like Colorado and Nevada and they got lots of postcards talking about how terrible public option would be? I mean, I live in Colorado. I got a lot of those postcards paid for by the insurance industry. So, what are the typical things they say to stop reform, and how do you counter those things? What's the truth behind it?
They play what I refer to often as the jobs card and the tax card. Those are the two principal cards that they'll play. And there are other lies that they tell or other important truths that they obscure. First of all, I use the word obscure purposefully because these campaigns often, they may have some basis of truth, but what they're trying to do is scare you into believing that something terrible is going to happen to you, and for you to be more content with the devil you know than the devil you don't know. So that's the game that they're playing. They invariably will say that the legislation will cost people their jobs, and they will say that your taxes will go up. The reality is when you have legislation that establishes a good, robust public option, more people will get coverage and have coverage that they can afford. So that is beneficial to everyone in the state, and it can serve to bring down premiums overall. If you have a plan that is competing against profit-making and profit-obsessed health plans, that will serve over time to bring down the cost of health insurance premiums. And consequently, I think the cost of health care itself, because a good public option can help to do that in ways that private insurance companies cannot, nor do they want to really do. Here's something that most people don't know. As healthcare costs go up, as the price of drugs go up, as the price of hospital care goes up, insurance companies don't care all that much. They talk a good game, but as that happens, they are able to demand more and more in higher premiums from their customers. And that gives them more money to work with to convert to profits. I used to handle financial PR for Cigna for 10 years, so I know how this works. But the jobs card, I think, is especially insidious. But the current system inhibits entrepreneurship. It continues to keep people locked into jobs. Thank goodness we have the Affordable Care Act and the marketplace plans, because that is available to people when they lose jobs or if they want to start their own business. But still, a lot of people are afraid of losing the benefits that they currently have. They may be richer than they otherwise would be, and cost them less than going to the ACA marketplace. So if you have a public option, for example, or even a single payer health care system, as California was considering, that can end that fear of job lock. And I think, in my view, unleash an era of entrepreneurship like we haven't seen in this country in a long time.
Absolutely. So, are there any other thoughts you would like to give our audience about healthcare reform, what they should be doing, or what they should not be listening to if they get scare mailers and they see scare ads on TV?
I would like for them to maybe follow me on Twitter at Wendell Potter. I write a Substack called Wendell Potter Now, and I am going company by company when they announce their profits every quarter to analyze how much money they've made, where that money is coming from. And it might surprise a lot of folks, actually surprised me, that almost all of their growth in their health plan membership, in fact, for some health plans, it's been entirely the only source of their growth, and that has been the public programs, Medicare Advantage, Medicare Supplement, and the Medicaid programs that these big insurers manage for the states. I was just reviewing Aetna's financials. Aetna is now part of CVS. Since 2010, the year that the Affordable Care Act was passed, Aetna has actually seen a decline, a drop in membership in its commercial plans. And the percentage of small employers that are able to offer coverage has continued to decline. Fewer than a third of businesses with 50 workers or less or fewer are able to offer coverage now. These companies, I've often said, know how to do one thing, and that's to make money. Two things. One is to bamboozle the public, and that includes our policymakers. But they have just been making out like gangbusters since the Affordable Care Act was passed. Before then as well, too. But they know how to game the system every way from Sunday.
Well, thank you very much, Wendell Potter. We'll be back next week, and our topic will be what to do when your insurance company refuses to cover the care you need, how you fight those insurance denials. And thanks for watching Care Talk.